Greetings to all who are attending this event. My name is Ricardo Soares Oliveira. I'm a professor of international politics of Africa at the Department of Politics and International Relations at the University of Oxford. I'm also co-director of the Oxford Martin School program on African governance. Only 2 months ago, it was assumed that Africa had escaped the worst of the COVID crisis. Most countries had reacted back in March and April in a swift and apparently well-organized way before the virus had swept through the continent. While South Africa and a number of North African states, which are well connected by dense air traffic to other parts of the world, saw widespread infection, most other countries managed to stave off COVID. In fact, much of Africa was being spoken about at the beginning of the summer as surprisingly resilient. More recently, however, concern has increased that the continent has merely postponed its encounter with COVID-19 and that the virus is silently spreading through countries that lack public health infrastructure and, most importantly, testing capacity, which may be massively underestimating the extent of COVID on the continent. Perhaps more important, it is now clear that the public health conversation, which has almost entirely monopolized discussions of COVID in Africa, is but one dimension that needs addressing, and that the likely long-term economic and political consequences of COVID, even in the context in which, from a public health perspective, the continent is spared the worst impacts, the other impacts, the economic and political impacts, will be very considerable and long-lasting, especially in terms of the limited resources that African economies have available to stimulate their way out of the current situation. To discuss these issues, we are joined today by two distinguished scholars and policymakers who will be providing us with insights about COVID's impact in Africa and the likely trajectory of African economies in the months and years to come in the face of what is a multifaceted and unprecedented challenge. So here with me are, first I'll introduce Benno Ndulu, who's the former governor of the Central Bank of Tanzania and now a senior advisor at Digital Pathways, as well as a visiting professor at the Blavatnik School of Government at Oxford. Benno has a very distinguished career, but I would emphasize in particular his establishment of the African Economic Research Consortium and his previous work at the World Bank, in addition to what I've already mentioned. And also with us is Professor Stefan Dercon, who's Professor of Economic Policy at the Blavatnik School of Government. He's the director of the Center for the Study of African Economies at Oxford, and also recently was appointed Policy Advisor on Development to the UK Foreign Secretary. In addition, Stefan is also the co-director of the Oxford Martin School program on African governance. We will start with Benno's presentation, and we'll proceed to Stefan's remarks. I would ask all those attending, you can see on your screen a button that says ask a question on the lower right side of the screen. If you write the questions there, I will be able to see them. And once Benno and Stefan make their presentations, you'll be able to put these questions across, or rather, I'll be able to put your questions across to them. So without further ado, Stefan, over to you. Benno, over to you.
Yeah, thank you. And greetings from Tanzania, where I'm still surviving the exact challenge that we are going to talk about today. Let me begin very quickly just by again, just reminding ourselves where we stand as far as the status of the pandemic as of August 31 in the region. The total number of infected, based on the African CDC data, is a little over 1 million, with 21,000 or close to 22,000 that are dead. There are two things that I would like to note in particular here. One is that there's significantly lower death rates generally across the region. It's estimated at about 7-fold less per 100,000 infected. than in the global average. I think there are many conjectures of that. One is simply youthfulness of Africa's demography, since only about 3% of the region's population is over the age of 65, which is the threshold for significantly higher risk. It's also another conjecture is immunity generating sort of persistent exposure to bombardment by virus infection being a norm of life in the region. And I think thirdly, predominantly rural population, not overcrowded and significantly distant from the main propagation sources and channels of infection. In fact, Center for Global Development has done a model and estimates that infection scenario without government intervention, while it would kill about 1.3% of Spain's population, it would kill only about 0.15% of Uganda's population. So, and this is purely based on the country's age distribution factor. So I thought I should mention that partly because you will see that a lot of countries have not been able to do as strict containment measures as one has generally heard about from the rest of the world. So there's significant diversity in the containment responses across the region. A good number implemented lockdowns with and without adequate resources. Those without adequate resources sometimes had to resort to use of governance forces to just enforce that people are social distance. 55% of sub-Saharan African countries actually ordered businesses to close, and further 17% advised workplaces to close. This data is available from a study done by IGC. Many declared state of disaster and used emergency laws for enforcement. A few, including my own country, adopted a light social distancing since they couldn't afford the safety net costs of lockdowns and relied more on personal hygiene and self-preservation. Virtually the Swedish model without the capacity for health system and safety nets, trading off lives for livelihoods. And in fact, in this particular context, fortunately, I think partly is the effectiveness of personal hygiene measures, including just wearing masks, that did a lot at the beginning, even for those that couldn't afford lockdowns. And I think also the demography part, which I had already talked about. Now, many countries were found actually at a point where there is already a lack of systemic resilience to shocks. And this is in 4 particular areas. First, years of underinvestment left the health system incapable of handling needed testing, emergencies, and care. It's important to note that most of the investments were actually supported through global funds, which are vertical programs, leaving little for investment in terms of infrastructure itself. So that deficit did show up. Second, a significant proportion of the region's population, about 45%, live a hand-to-mouth existence, which means they couldn't survive under lockdowns. 3, lack of personal cautionary savings or a functional credit system also curtailed household means, I think, for survival during containment and social distancing. And finally, lack of fiscal space and mature financial markets did constrain resource mobilization. Now, it is important to note that the responses to the pandemic were made against the background of very high levels of indebtedness. Virtually 8 countries were already categorized as debt distress, another 9 in high risk of debt distress. Only 4 countries in the whole of sub-Saharan Africa, low-income countries, were categorized with low risk of debt distress. So this added to the fiscal constraints fiscal space constraint that I had mentioned earlier. There was also a reverse flow of private capital during this period, the region losing nearly $5 billion, which is 0.5% close to that of GDP since the pandemic. This data is from IMF. And of course, there was also collapse of remittances. World Bank projects a 23% contraction of remittances to the region as sources are hit hard by the pandemic. And finally, just tight aid resource envelopes as giving countries themselves face challenges of their own, allowing only for reprogramming rather than adding to resource envelopes of what is being given. I happen to sit also on the IDA committee, and I know for sure that this particular constraint has come through in a very clear sense. Now, the bulk of the damage to the economy has been from responses to containment of infection, both at home and abroad. So Africa now is going through its first recession in 25 years of growth. It will shrink by about 3.2% in 2020 before recovering to a growth rate of 3.4% in 2021. But because the shrinkage will have a lower base for the economy, it means that Africa probably won't get back to its the pre-pandemic level of or size of the economy before 2022. And excluding South Africa and Nigeria, however, the shrinkage is much smaller. It's 0.6%. Because South Africa, I think the shrinkage is by 8%, and Nigeria, the shrinkage is by more than 5.2%. So, and since these are two giants, they carry the weight in the overall regional contraction in the economy. By the way, it is important also to note that 14 countries out of the 45 countries will actually avoid a recession. They will still post positive growth, but significantly less than what they experienced even the previous year. So the source of damage to economic activity is twofold. First, temporary shutdown of activity internally for containment of infection. And second, which is the larger damage of economic activity in African countries brought about by immediate global reaction to pandemic, particularly closure of borders. Tourism has been hit very hard. It accounts for 7.1% of GDP. And actually the loss which has been mentioned is almost equivalent of more than 70% of tourism receipts during that particular period. There has also been major impacts on the poverty side, and the region will suffer its first setback in progress towards poverty reduction in 2 decades. IGC has done a marvelous set of surveys, and based on that, so an additional 9.1% of the population in sub-Saharan Africa have immediately fallen into extreme poverty as a result of the COVID-19. About 65% of this increase has resulted purely from lockdowns, as opposed to the other impacts. And 31.8 million people, or 3.6% of the population, including 3.9 million of children under 5, are very severely food deprived at the end of the 8 weeks of first lockdown. So this, I think, is a game changer in terms of experience. The fiscal stance that the countries have taken in Africa, I think, is just too prudent. I think it borders timidness. And in fact, if you look at the total fiscal stimulus as a percentage of GDP for sub-Saharan Africa, it is at 3%. This compares with double-digit levels virtually for all the developed countries. I know partly it's a constraint in terms of space, but I think there is no way in which these countries can push back to growth if they actually adopt pro-cyclical policies. So let me try to get to wrap up now, since I think the time is clear. Just to say one thing, is that the pandemic has underlined the case for dealing with also digital divide, since a good number of those that couldn't be onboarded prior to pandemic actually also happen to have had much harder time making adjustments in the course of the lockdowns. So let me stop there.
Benno, let me start with a question that we put on our blurb and on our title, and which I think attending the conference would be interested in exploring further, which is the element of opportunity. That this is both a crisis to be endured, but there is still some leeway for policymakers, first to cope with the crisis in a less damaging way, but second, that there may be COVID opportunities, as someone put it, to explore. What would you say to that?
Well, I think the biggest opportunity that has come out of this experience is that it has made a very clear case of the importance of digital transformation in order not just to make a transition to the digital economy, but much more in the context of addressing the digital divide. It's very clear that those that didn't have online services and had to resort to education did suffer significantly, partly because they just didn't have the means. And I think it has convinced most of the governments now that they cannot stay back on this. Yeah.
Are there any African states in particular which you think, looking at the last 6 months, have coped with the digital challenge in a more efficient way?
Since I'm also advisor to the president of South Africa, I've had a front seat looking at what the country, which has probably the largest capability to be able to address this issue. It's amazingly, from its history, the divide is still very large. Close to 91% of the children couldn't quite, have a substitute for online courses from homes, partly because the majority happen to belong to the lower income group and simply don't have the means. But you could see steps being taken by various governments to lower the cost of data, for example, the price of data, to relax, let's say, limits in terms of money that flows through the mobile payment system, etc., in order to really sort of cope with that particular situation.
We have a specific question in this regard in terms of opportunities, in terms of proactive policies being pursued in Africa. And the question has to do with the sector from Professor Tabitha Kiriti Nganga. She asks if the manufacturing sector has taken up opportunities for manufacturing of formerly imported items, which now are produced in Africa, if there's any movement in this regard. And as a comment that is made in regard to this question highlights, realities are very country specific and even sector specific. Africa story in this regard. But if there was any manufacturing dimension here to highlight, what would that be?
Well, I think probably mostly would be not manufacturing of the large scale type, but mostly from SMEs, which provided the kind of
from SMEs,
small and medium scale enterprises. So what I'm saying is, since January there was closure of most of these activities, maybe any substitutes during such a short period of time, it has been what, 2-3 months mostly. It would be mostly in terms of local products that typically are produced on a smaller scale, just to plug the supply chain constraints and disruptions that had taken place. But a good bit of the usual sources like China, etc., were quickly getting back, I think, online on that. Maybe on the medical side, South Africa definitely has made huge strides in producing medical supplies of all kinds, including the more complicated machinery. They're self-sufficient, more or less now. Of course, post-COVID, I don't know what that capacity would be, but it could still be turned into something else.
Benno, with your permission, do you mind? I will give a couple of comments, and then we'll have a further dialogue around some further issues. Is that okay?
Yeah, sure.
Yeah, okay. So there's a couple of points I wanted to make, and I think my internet is now far more stable. If we think of the nature of the impacts in Africa, and there's a big concern of what does it actually mean for people and how actually they are now in the short and longer term affected by this. I think it's very clear, and we need to drill home that point, is that except for a couple of countries like Northern Africa and countries like South Africa, the crisis itself, the health crisis, seems to be less deep than we had anticipated probably and thought of it. And Benno gave extremely good reasons for that. Meanwhile, the policy response had been very much a copying response of what other countries were doing. So you actually get a very striking thing, is that saying either Africa did just enough, or maybe it did more than it needed to do on the health side. And that actually maybe we'll have more collateral damage than we actually intended. And look, this is not trying to criticize policymakers, but there has been quite a lot of collateral damage from it. But even then, the second point on economic livelihoods and on poverty, there has been, of course, impacts, especially in the countries strongly affected, where they had to go for more extreme measures on economic livelihoods and other aspects. But in a lot of countries, the lockdowns, they did in the short run affect people's ability to go about their life. And Benno mentioned already some fascinating statistics coming out of Nigeria, where, for example, in being active at your place of work, being again doing the work in the place of work where you were meant to do it in rural and urban areas, the statistics are more or less back to where they were actually in March, just before the crisis started there. It's actually quite interesting. So people are being active, but it doesn't mean, so they've lost definitely earnings in a period from lockdown, whether it was stronger than needed, we can always keep on arguing about, or maybe just enough. But in principle, they can pick up their livelihoods. Still, we do expect longer-term poverty impact to be big, to a large extent, of course, coming from these very coming from these very large shocks that are happening in the world economy. And it's Africa's interdependence of the world economy that actually causes the biggest hardship. But there's a third one that we shouldn't forget. There is plausible long-term impacts as well. There are plausible long-term impacts as well. And they are, for example, we see them in education. Even though people are back to work, schools are clearly in many places not functioning as before. And so actually we still have an awful lot of children attending regular schooling and so on. So the longer term impact on people may well be there as well. So if the connection is still good enough, we say three things that I think to keep an eye on going forward in terms of the Africa crisis. And this is the kind of thing I think with the Oxford Martin School Africa Governance Program we will keep on wanting to keep on looking at and focusing on. So the first thing is to make sure that the long-term consequences are as short and limited as possible. It becomes now a real game of being concerned about long-term consequences. So the growth losses, getting the economies to get going again, there's going to be a real thing. The real risk we have is that these shocks are going to continue to exacerbate around these economies. I have a worry at times that this is like the early 1980s, where most of the world economies slowly started picking up again in a couple of years. Africa took 10, 15 years to get back to its growth trajectory. The second one is the political and governance consequences that we shouldn't underestimate. These big crises with a lot of pressures. But thirdly, there are opportunities here as well. There are opportunities here in a resetting of the social contracts with citizens. You know, these are big shocks. There are opportunities in stepping into value chains, because also, you know, the appetite from the West maybe not to be dependent on China. And then thirdly, it's on the digital side. I'm not sure my line is strong enough, so I'm going to stop here now to allow the discussion to go a bit further, and I'm happy to continue on this. Thank you.
Thank you. Thank you, Stefan. And I think the technical problems should be sorted by now, and we'll be able to have the rest of a very good conversation. Ben, we have a question here from Chris Adam at Oxford, which I think Stefan would also be welcome to comment on. And Chris asks about your earlier statement that the fiscal response of some, arguably many governments in Africa has been, you said, too timid. Given that there's such a limited amount of external support, how do you see a more aggressive fiscal response being financed? Is there scope for more domestic borrowing? Can central banks do more with their balance sheets? And if they did that, what would be the risks of going that way?
Well, notwithstanding my central bank background, I think there is definitely scope for quite a number of countries to do a lot more through probably more accommodative monetary policies. A number of countries have done it, but have become or continue to be much more timid than they should be. Now, the timidity part of it is the following. Although Africa's contraction this year will be 3.2% compared to the world's 4.9% contraction, the world will recover in terms of growth of almost 5.8% next year. Africa's growth will only recover to about 3.4%, which definitely tells you that notwithstanding a lesser haul, we actually are going to probably have a much more stretched recovery period than the rest of the world. Of course, we can bank on the rest of the world pulling us up again, because in any case, going down, it was that which probably hit us most, as Stefan actually had indicated. So the central banks can use a bit of seigniorage revenue. I think I wouldn't put as out of scope any lending to government. We did that after the global financial crisis, and it worked well. And we did that with the consent of IMF too. So it's not something like rebellious. So I think given inflation levels, for example, South Africa, with a whole as big as 8% drop in growth of the economy, I think their stimulus package is somewhere close to about 11%, and United States is upwards of 28% and above, and inflation expectations in South Africa going all the way up to 2023 is somewhere close to about 4.2, 4.3. So I don't see the reason as to why one is not doing more in terms of that. Yeah.
Stefan, would you like to speak to that very briefly?
Look, I would probably defer largely to Benno's viewpoint. I mean, what I don't think Benno is suggesting is going to the kind of scale of measures that are possible in richer economies at the moment. We hear exactly. So we have to be careful what we say. There should be more. I hear sometimes people saying, "Look, we should just do like Britain, like the US, and having these kinds of massive amounts of there, the fiscal space, simply the economies are not like that." That's my simple qualifying point here.
Yeah, and I agree with you, Stefan, completely, because US expansion of the Fed's balance sheet, 60% of that money is held outside. So we are paying. All of us are paying for that. Yeah. So we don't have that luxury. So we are aware of that. Yes.
We have a question about the impact of COVID on infrastructure and logistics, especially on the supply and distribution of HIV medication, where treatment interruption can be a major problem. This is just the example that has been raised, but the broader issue about infrastructure and logistics and what impact that might have. I wonder, Stefan, if you'd like to speak to that.
Yeah.
And then I'll ask Benno the same question.
Very, very briefly. I mean, the logistics and infrastructure part is just one part of it. I think from the beginning, I've always been more worried in the health side or in terms of the collateral damage on the preventable deaths, on the vaccinations, on the antiretroviral drugs, and all these kind of issues with having these kind of quite draconian lockdowns that I can still not judge whether it's right or wrong. That's not, and I don't want to question it, but actually too little attention has been paid. And I worry still even now, too little attention is paid to make sure that alternatives are found for the functioning of ordinary health services. If there are in due course, I mean, mortality figures in Africa as deaths, very few will be linked directly to COVID. Many more will be linked indirectly to COVID, to the shutdown of basic health services, the movement of people. And that includes, of course, also the import of vital equipment and supplies. But I think it's a lot to do with locally closing down vital health services, or maybe overcompensating, or less mobility by health staff and so on. And it's not like one question that anyone did it not in good faith doing these things. But not enough attention, I think, has been paid, and that will still pay the price for it, unfortunately.
Benno, I wonder if you'd like to address that question as well.
Well, I'm very much along the lines of Stefan there. The collateral damage, we are already seeing immunization taking a rather big hit, partly because resources also had to be diverted, and what we call as development assets, including infrastructure and human capital. What we saw in the 80s, that whenever there is this fiscal pressure, the first things that go is not investing in these assets and not providing enough for upkeep, which is the recurrent cost side. So these are part of the package of the long-term effects that probably Stefan was also referring to.
Okay. We have a question about the extent, if any, of the intensification of political cooperation within Africa on COVID-related issues, on sharing experiences, or on finding intra-African substitutes for goods previously available from the outside. Is there any activity beyond rhetoric? Is there any concrete coordination, if not at the Pan-African, then in regional communities, that is worth emphasizing here?
Let me take a stab at that. I think so far I've only seen the Southern African countries sort of trying to get together, at least in one conversation, to try and see whether they could coordinate. But I think the most dominant impact has been closure of borders. So it has tended much more to be disruptive than cooperative, partly because, movement across borders has been impaired. For sure, for Tanzania, I know for sure that if you want to go to Kenya or you go to Zambia, there are very many constraints right now. So that has reduced the mobility part and possibility of sharing solutions.
Stefan? I think Stefan is not with us. Ben, let me ask you a question regarding debt sustainability, because the earlier issues that you tackled had to do with the possibility of African financing themselves out of this crisis. But a lot of African governments had already accrued on the eve of the COVID crisis debt burdens which were becoming difficult to sustain, at least in some cases. What sort of impact do you see COVID having in this regard? We saw over the summer China rescheduling debt, renegotiating debt with a number of African countries. But the larger debt scenario is, at least in some parts of Africa, very over to you.
Yeah,
on this issue.
I think too often we speak about the numerator in the debt to GDP ratio, which always points to whether you are borrowing too much or not. But the denominator is where I think most countries will get mostly hit. And since there is going to be significant reduction in growth, at the time when spreads and risk premium for these countries is going up, the dynamic sort of sustainability of debt is put into a whole bunch of new sets of pressures. First, interest rates exceeding growth rates, for sure, because we don't have negative growth rates interest rates while we are having negative growth rates anyway, which is definitely a big problem in terms of explosion of that ratio. And it is also true that because people are thinking about fiscal consolidation at this time, which is pro-cyclical, it just tends to make matters even worse, because it takes away from spending to get growth back. So I think we'll be in for a fairly tough time. But different countries have different scenarios to work with. As I said, 8 countries are already in distress, 9 countries high risk. About the rest, the bulk of the rest are in the medium risk, and only 4 countries in low risk, including my own, where I led the charge to keep that low.
Thank you, Benno. We question specifically related to the digital dimension that you highlighted in your comments. Our participant notes that one limitation with digital innovation in Africa is the lack of policy by host countries. This means policy is almost always trying to catch up with digital innovations. So the question is how makers in this particular context shift focus towards a more forward-looking policy to avoid playing catch-up and maximize long-run benefits of digitalization.
I see Stefan is back.
Stefan is back.
Yeah, so maybe he wants to take that one first. Or?
It didn't have a full question, Benno. Why don't you start and I'll give an
Okay. It is true that we most of the countries are playing catch up in this. So that historical fact will be there. But I think I've seen an acceleration, partly because countries have moved away from looking at digital transformation as a technology sort of issue, which is embedded in the Ministry of Communication, etc. Rather, they're seeing it more and more as an economy-wide means to making every sector more productive and more efficient. So that requires that one does a strategy which is much broader. We are helping from digital pathways a number of countries right now, which have moved very fast, really to adopt a forward-looking approach and preparing digital transformation strategies that are much more holistic. And I think COVID has made the case for that to happen much more frequently and faster.
Stefan?
Yeah, just let me add to that. It's, COVID obviously has made governments much more conscious that these kind of things are a necessity. Of course, there's lots of risks here that things will be done in a hurried sort of way or in a very poorly governed space. One of the things I think with work that I've been doing also with Benno is to emphasize you will need to start thinking about that economic governance from day one. You can't just grab bits and pieces and then think it will be happening. And look, and it does mean, your Ministry of Finance, your Prime Minister's office, your President's office are better take an interest in it because it actually has to be properly joined up. There's maybe a second point, the final point I want to make on it, is that another thing that has come out is that all over the world, people have discovered that actually working online, I mean, we're not giving a massive positive advertisement for it, but most of the time we all experience that actually a lot of things are possible. And that being physically in the same place is not a necessity for an whole series of activities that we probably thought in the past we couldn't quite do this way. Now, what that means is that, say, for Africa, it actually is also a massive opportunity, because if we discover we can do this, we don't always have to have, say, in London, all the best paid people doing massively paid people doing certain jobs. That actually just as well can be done by extremely able people all over the world. And so you could have, white collar jobs moving to other parts of the world, not necessarily badly paid, maybe a little less paid than we pay in London, but much more competitive, new entrants in these markets emerge, and so on. So I kind of think let's not underestimate what it actually means for value chains, including services, that it actually creates a set of new opportunities. that previously we didn't do.
But Stefan, I think a key question, and this argument about, let's not call it offshoring of jobs, but specialized skilled jobs having a different geography or no longer being bound by space, as it were. Would Africa be the net beneficiary of that process? Or would, in the first instance, jobs that leave London, would they go to other middle income economies rather than sub-Saharan Africa, in the first instance, at any rate?
Look, there won't be the net.
Could you put off the video? I think we're again losing you, perhaps without the video. I'm also going to put my video off.
Okay, so this is, so in the first instance, I think it's not that Africa will lose from it, but and it's also not necessarily offshoring. This is not a zero-sum game. Economics is never a zero-sum game. There's gains to be had. And yes, I agree. It will also possibly go to other places. But fascinating work that Benno has been closely involved in, and I have, in South Africa around the pathways, is that actually, they see it really as an opportunity to job creation. And yes, South Africa is a middle-income country, but also has very close connections on all kinds of professions with other parts of Southern Africa. And so there's other opportunities there as well. Let's not be too negative about it. Yes, you're right, but that maybe in the first instance, there may be other locations. But Africa has an awful lot of very highly qualified graduates doing all kinds of things. I remember in Ethiopia, a fascinating firm that actually had specialized in providing services to a Dutch firm. And it was all around the kind of statistics that are being collated during football matches and cricket matches. It was done in Addis Ababa to get on our screens everywhere the progress statistics from the players. This was a tiny firm in Addis Ababa doing this. It doesn't all have to be in Silicon Valley, or indeed, it doesn't all have to go to India. I think Africa can find niches and opportunities, new opportunities there as well.
Thank you, Stefan. We have a question which has more to do with social policy than with economics, but which I think we should tackle. Question 2, with the status of groups, the elderly, those with disabilities. A lot of what we read about Africa as dealing with a crisis emphasizes the extent to which most of the population is young and therefore less susceptible to COVID. But assuming that we're not done with COVID yet in sub-Saharan Africa, and that there are large numbers of elderly, of those with disabilities, and also Africans with comorbidities that make them susceptible to COVID, what do you think what sort of policies do you think exist? Obviously, the response will be country specific, but the question has to do with the extent to which Africa will be able to shield some of these fragile groups in the coming months, in the coming year.
So let me take this first. I was very struck that some of the examples from all over the world, relatively low-income countries, to actually doing quite successful policies in this space. I think of Kerala, I think of Vietnam, that actually are emerging as having that good balance between general health services, shielding vulnerable population, and meanwhile still doing things to contain the virus. Look, these things are not easy. Elderly people live in communities, live with lots of other people there. But I think the core for all these groups typically is probably twofold. Is community health services, being not focusing just on what you do with your hospitals and your ventilators. And I'm very glad to see that wave has moved away from many parts of the world. That is not just all about ventilators for the middle class, but it actually is also about community health work, maybe targeted transfer to make sure that they can actually effectively shield and so on. So I think there are examples from other parts of the world that is possible. There will be, it will take a couple of years to know the record of various countries really in the detail. How well did they do? All countries have claimed they will do certain things in it. The evaluation will have to happen. But there are definitely already success stories emerging, not necessarily from within Africa, but from Kerala or from Vietnam, that actually are worth looking at what they did, and countries should definitely follow that. So it's not impossible. I don't think there is any need to say we need to write of these populations. There's enough things that can be done with relatively scarce resources to do much better probably than it's happened.
We only have 2 or 3 minutes left, but I wanted to end by asking both Benno and Stefan a question. If you can address the question, a complicated question, so for which we'll have to find a simple and simplistic answer, I'm sure, which is to do with the impact of commodity dependence on African economies. Once again, as in many prior instances of a global crisis, we've seen the impact of that global crisis on commodity prices and the immediate fiscal impact in states that are dependent on the export of agricultural and mineral commodities. Do you see any thinking and policy, or thinking or policy, already playing out that seeks proactively to diversify away from that overdependence on commodities? In other words, are the lessons of the last 6 months sinking in, or are most African economies too dependent on those commodities and they're not really able to cope in this regard, at least in the short term?
Benno first, maybe?
Yeah,
Or Benno?
I would say two things. One, I think African countries are slowly learning how to live with volatility in those markets, and part of management of booms, etc., is part of that story, because they can't very quickly move out of that. But certainly there are also significant efforts at diversification. But by and large, I think management is probably going to be a solution for a little while. Volatility of management of volatility. Yeah.
So,
Stefan?
let me quickly add. I think there is already quite a lot of, and it's implied by what Benno says as well, a lot of heterogeneity, differences between countries. Nigeria is a bad example. There are other countries that are doing already much better. And I think we should just recognize that there's going to be multiple speeds of attempts to diversify. You don't really solve that during the crisis. The thing is that we just have to recognize that the boom period a decade ago and for a while, that was the moment to do it. And a lot of countries didn't quite do it. And I think you don't do it when the prices are low. The main thing is to lock yourself in, to commit that once the prices go up again, that you still want to do it. And I think we wasted the super boom of the earlier part of this century to actually do it. We'll probably have to wait when prices go up to get the space to do it. But the commitment has to be made now. How we can politically lock that in, I don't know. But that's what needs to happen.
Stefan, Benno, thanks so much for your insightful remarks. And thank you to our audience for staying with us despite the technical difficulties, and to the Martin School for hosting our event. Thank you.
Thank you.
Thank you very much.